I'm here today to talk to you about the term myofascia. It is a buzzword in my industry and I'm seeing it being used all over the place too in the fitness world. So I wanted to explain it to you guys to give you a quick overview of what it is that we're talking about. Well, first of all, myofascia means muscle and fascia. And why do we care about it? Because this tissue, it can get tight and painful and it doesn't let us move very easily. So we want to take care of it. We want to feel better, right? Okay, so fascia, I think that needs a little bit more explaining. We don't always know what that is. Fascia is a web-like structure that is everywhere in our body. It basically lives underneath our skin, surrounds every single muscle, every muscle group, every muscle fiber, down to the cellular level. It's even around our spinal cord and our brain. It is an important structure that can really affect how well we move and how well we feel. So one common way to take care of the myofascia is to release it. So what does that mean? In clinic, what I'll do is I have a bunch of different techniques and tools that I use to soften this area, to get it to move and be a little bit more pliable. I'll use things like scraping tools, my hands. We can get down to the muscle tissue and release knots that live in the muscles with dry needling. But when we talk about self-release techniques, that's when we're talking about foam rollers, mobility balls, all those different shaped tools to take care of your body yourself. Now, studies do support use of foam rolling. I'm just not sure that it gives a really good explanation as to what it's doing, and I don't know that anybody knows, other than the fact that we do know these tools help increase circulation. And when we can get more blood flow to an area, we get more oxygen and our body just feels better and works better. It also helps to remove toxins that like to sit around trigger points. So, hey, trigger points. Trigger points are knots inside muscles. So when we use some of these tools, we can also release trigger points. I just wanted to give a little explanation about how the release can happen and what is going on when we're talking about fascia. And so the way that I want to explain that is someone told me think of like a 4-inch by 4-inch piece of leather. If you take that leather and you just tug at it, it's really not going to change its shape, right? However, if you beat that leather, if you roll on that leather, you can soften it. That is what happens when we foam roll fascia. Especially I'm thinking about the IT band that goes along the side of your hip to your knee. That's a really common area to treat. Now, one thing I want to tell you guys when you're doing some self-release techniques, you don't want to be in so much pain and agony that you're fighting it. Like those really tough rollers with all those nubs on there, some people can tolerate that and it's perfectly fine. It works really well for them. But most people, it hurts so much that that is not going to help you. The reason being is because it's giving your brain a message that you're hurting yourself and your brain is going to fight back. So when you're trying some of these release techniques, I suggest you find the tool that feels like it's doing something, but your whole body's not cringing on it and fighting it. I hope that's a good explanation for you guys. If you have any questions, drop a comment below this video. Thanks. Bye.